Yeah. I think the big sort of acute moment of realization was came at around 2:30 in the morning, when I was up with insomnia, which had been plaguing me for some time, and I found myself just sobbing. Um, and I think that was that, there's that quote by a nice nin about the risk remaining tight in the bud is more than the pain of trying to blossom. That was that moment for me. But while that was sort of the big acute moment, I think there was a lot of small moments along the way that were signals that I was experiencing burnout. So um, I remember talking to, I practice pediatric palliative medicine, which I find incredibly meaningful. And I know usually when I tell people that I do that work, there's a sense of, oh, I don't know how you do it. And certainly it comes with its challenges, but I just found it to be such a privilege to walk alongside these children and their families and try to find ways to ease their suffering and then I'm grateful to learn from their journeys, and so that far outweighs the heartbreak that sometimes occurs. Um, and in that journey, I had been building a palliative care program, and so there were several moments. One was I was speaking with a fellow palliative care physician across the country and sharing with him that I had applied to be the wellness director for the Department of Pediatrics, and he just sort of offhandedly said, maybe if you're starting to look for things that are a little peripheral, you're getting crispy. Maybe you're starting to get a little burnt. Um, and then I remember um, talking with my division chief, and I didn't call it burnout. I called it not sustainable because we weren't staffed to see the volume of patients that we needed to see. And um, I remember talking with her about it and found myself saying that I was actually dreading coming to work and that the joy that I used to find in seeing my patients was no longer there. And so that was a big signal. And then, and I will say that I didn't want to acknowledge both when my colleagues said you're getting crispy and when I heard myself say this, I was still like, no, I'm not burned out. This is, like I said, sustainability or whatever. And then I think as I started to delve into other areas, the people around me were pointing out how different my energy was when I was talking about some newer elements of my work compared to um, running this palliative care program and that dimension. And then I think finally I was just like, I'm very grumpy at home, and I don't know why. I don't particularly like it, and so there was all these little moments I think where it was becoming apparent that that's what I was experiencing. And then there was that big moment of I just, this is I have to think about what it's going to take to blossom instead of remain in this bud.